House come to order. Calendar for the day. First bill on the calendar for the day is House File 106. Clerk will report the bill.
House File 106, number 1 on the calendar for the day, the first engrossment, a bill for an act relating to human services.
I recognize the author of the bill, Representative Zerwas, who will explain the bill.
Thank you, Mr. Speaker. Members, House File 106 is the Community EMT Technical Fix Bill. The Department of Human Services reached out in working with CMS and has asked for a language tweak to clarify that we can also provide community EMT services post-discharge for both hospitals and skilled nursing facilities. And that's the gist of the bill, members.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File 106.
Third reading. Discussion to the bill. Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. Selk votes aye. Joachim votes aye. Being 128 ayes and 0 noes, the bill is passed and its title agreed to. Next bill on the calendar for the day is House File number 827. The clerk will report the bill.
House File 827, number 3 on the calendar for the day, bill for an act relating to civil commitment.
Recognize the author of the member from Sherburne, Representative Zerwas, to introduce his bill.
Thank you, Mr. Speaker. Thank you, members. House File 827 was brought to us by the Ramsey County Attorney's Office. This is a technical fix on a bill that we passed last year dealing with notification for 72-hour holds. If an individual is released from a 72-hour hold prior to admittance, having that hospital notify the law enforcement agency that dropped them off in case they needed to alert family or whoever first called 911 for that hold. Ramsey County noticed that there is a federal regulation, Title 42, that limits for inpatient alcohol and drug treatment programs how much information can be released. And so this is an exemption for that facility in Ramsey County and any other facilities that operate under federal regulation 42.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File 827.
Third reading. Discussion to the bill. Discussion to the bill. Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. There being 130 ayes and 0 nays, the bill is passed and its title agreed to.
Mr. Speaker,
For what purposes does the member rise?
point of personal privilege.
State your personal privilege.
Thank you, Mr. Speaker. And members, I'm pleased today to introduce former Representative Steve Wenzel, who used to occupy my seat and came in 1973 with Representative Lyndon Carlson. So if we need to go back and share memories, we have another person who can do that. But I'd like to introduce Representative Steve Wenzel, who's on the House with us. Welcome.
Next bill on the calendar for the day is House File 952. The clerk will introduce the bill.
House File 952, number 4 on the calendar for the day, the first engrossment, a bill for an act relating to health.
I recognize the author of the bill, Representative Kiel, to introduce her bill.
Thank you, Mr. Speaker and members. House File 952 is a bill about hearing and hearing loss. It is a requirement for training for senior facilities. Age-related hearing loss is even linked to dementia and cognitive decline. What this bill intends to do is to make sure that staff in a health facility, whether they are an RN or someone who is maintaining residents' rooms, that they understand the importance of addressing a resident, making sure that the lights are good enough for them to see, and help them to be able to communicate their wishes and desires. Very important. If we don't help them with that, it ends up being that many people who lose their hearing also become isolated, not just by not having communication, but also by depression and just all-around loneliness. They can be in a crowd but not hear anybody, and it's very important that we make sure that they participate and are active in the ability to do things in a senior facility or anywhere. And I remind all of you, when you are dealing with people that are hard of hearing, whether you know that or not, make sure you speak to people so that they can see you and know that you're addressing them, and certainly give them the attention that they need. With that, thank you.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File 952.
Third reading. Discussion to the bill. Seeing none, clerk will take the roll on the bill. Hamilton votes aye. Clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed and its title agreed to. Next bill on the calendar for the day is House File 959. Clerk will report the bill.
House File 959, number 5 on the calendar for the day, the first engrossment, a bill for an act relating to health licensing.
Recognize the author, Representative Dean, who will explain the bill.
Thank you, Mr. Speaker and members. This bill was passed last year, and it allows eminent physicians from other countries to come to Minnesota and be licensed at the University of Minnesota or the Mayo. And these are just very, very rare circumstances for physicians of extraordinary skill that don't have to then go through the licensing procedure that not 99 out of 100, but 9,999 out of 10,000 would do. This is for the very, very rare circumstance. We were able to pass this very quickly last session, and Mayo Clinic was able to obtain the skilled physician for this already. It's worked out extremely well. This is a world-famous surgeon who's able to practice now in Minnesota and offer his skills to our folks here in Minnesota. What this bill does is it extends that. We put a sunset in it because we wanted to make sure that it worked well, which it has been working well. We also wanted to put a lot of strict standards up so that, as we all know, with any sort of licensure, that there is very strong and legitimate concerns around that. We have addressed those. That's what the bill does, and I believe there's an amendment, Mr. Speaker.
There is an amendment at the desk. The clerk will report the amendment.
Dean M. is moving to amend House File 959. The first engrossment is followed. This amendment is coded A1.
Call upon the author of the amendment, Representative Dean.
Mr. Speaker, members, this just moves $1,000 into the account that spends money on license fees that will allow this to take place. That's all the amendment does. Appreciate your support.
Discussion to the amendment. Seeing none, all those in favor of the A1 amendment, please signify by saying aye. All opposed, no. Motion prevails. The amendment is adopted. Discussion to the bill. Clerk will give the bill its third reading.
Third reading, House File 959 as amended.
Third reading. Discussion to the bill as amended. Seeing none, clerk will take the roll on the bill. Clerk will close the roll. There being 130 ayes and 0 nays, the bill as amended is passed and its title agreed to. Next bill on the calendar for the day is House File 1186. The clerk will report the bill.
House File 1186, number 6 on the calendar for the day, the first engrossment, a bill for an act relating to human services.
Recognize the author of the bill, Representative Pierson.
Thank you, Mr. Speaker. House File 1186, this bill seeks to expand access to children's mental health day treatment services by defining education and training requirements and broadening the role of staff in these settings. It was developed with input from many stakeholder groups, supported by the Mental Health Legislative Network, and it's been well vetted in our committee process, and I do have an amendment.
There is an amendment at the desk. The clerk will report the amendment.
Pierson is moving to amend House File 1186, the first engrossment as follows. This amendment is coded A2.
Call upon the author of the amendment, Representative Pierson.
Again, thank you, Mr. Speaker and members. This new language just clarifies that the practitioners in this setting are exempt from the 2,000-hour requirement if the treatment program delivers 40 hours of training within 6 months of their employment, and that there's weekly clinical supervision during the 2,000-hour period. So with that, I ask for your support on the amendment.
Discussion to the amendment. Member from Hennepin, Representative Loeffler.
Thank you, Mr. Speaker, and I'm wondering if the author would yield to a question.
He will yield. Representative Loeffler.
I know that we're suffering a mental health workforce crisis, and we've responded to health workforce crisis in a lot of different ways, with scholarship loan forgiveness, with paid internships. But in general, we haven't done it by weakening the requirements for the profession. And I wonder, Representative Pierson, why you put in your amendment 40 hours of training over 6 months. That means someone's going to be working in a treatment center, actually doing the work, only meeting weekly with a supervisor, and yet the training is spread out over 6 months rather than in the first month of their stepping up to this role after achieving a college degree. Could you explain to us why you felt the 6 months was necessary?
Member from Olmsted, Representative Pierson.
Thank you, Mr. Speaker, and Representative Loeffler for your question. The 6-month period and the additional hours of training actually is providing additional training to those people during that 6-month period that they currently don't have. And what this program does is it provides a setting for people to get the 2,000 hours of their requirements fulfilled in a setting where they are supervised. So this really is just the best setting for this type of training for people who are going into this part of the workforce. It's currently a little bit of a bottleneck for getting people the training that they need, and by putting in this additional training requirement, they're getting additional supervision compared to where they currently are.
Representative Loeffler.
Well, thank you, Mr. Speaker. Members, I am still concerned because we broadened the degrees that are eligible to be considered a mental health professional, many of which do not provide or require clinical training. And so if we're going to take people from a broader range of degrees, it's really important that when they get out doing actual care, that they be trained before they start doing it and that they be closely supervised. And I'm concerned that we're really loosening the professional standards, and that there might be some other ways we might be able to step up to better help this profession grow and expand with a much more intensive supervision rather than a watered down one.
Representative Becker-Finn.
Thank you, Mr. Speaker, and I just kind of want to reiterate what Representative Loeffler just said. Just want to be clear that the problem we're solving here is helping facilities become compliant with the law. We are not helping the problem of the fact that we do not have enough people to fill these jobs. These are very difficult jobs. We're talking about dealing with people with serious and persistent mental illness. We're talking about schizophrenics, people with schizophrenia, bipolar disorder, schizoaffective disorder, very serious mental illness designations. And what we're doing here is we're lowering the standards. And so I understand that we're in a crisis as far as having the bodies that we need to supervise folks, but that is not going to equate to a higher quality of care for people. And I just have some concerns that we're really opening the door for other mental health programs to be rolling back our standards in the quality of care that we're providing to Minnesotans who struggle with these illnesses. So hoping that we can, move forward in the future and actually addressing the problem of the low wages that people are paid to do this really difficult work. So just want to be clear that the problem that we're fixing is for facilities, not for the people suffering from mental illness, because now we're going to have people with lower qualifications providing that care. For instance, I have a bachelor's degree in psychology from 16 years ago, and I could go now work in one of these facilities because I have a 4-year degree, and I have no experience in the field, but this would allow me to do that, and I don't think that's the kind of thing we want to be doing. So I'll likely vote in support just because I understand it's a short-term fix, but I hope that we can address this better moving forward.
Member from Stearns, Representative Howe.
Thank you, Mr. Speaker. And I've got a neighbor that's got a master's degree that would love to get his training so he could actually be qualified to do this. And what happens is he can't get his internship to get his hours in to become trained and be able to be qualified to do this. So he fits right into this thing. So thank you.
Further discussion to the A2 amendment? Seeing none, all those in favor of adoption of the A2 amendment signify by saying aye. Aye. Opposed? Motions prevail. The A2 amendment is adopted. There are no more amendments at the desk. Clerk will give the bill its third reading.
Third reading, House File 1186 as amended.
Third reading. Discussion to the bill. Member from Hennepin, Representative Thiessen.
Thank you, Mr. Speaker. And I just wanted to rise briefly. There's a provision in the bill that is expanding the ability of people to get paid for doing work that we want them to do, which is prepare these treatment plans. But the way it's written now is that you only get paid for the work if the treatment plan is actually completed. And it seems to me if someone is doing work on behalf of the state, we should pay them. So I hope that we can fix that in the future because it just seems pretty fundamentally unfair to me.
Further discussion? Seeing none, the clerk will take the roll on the bill. Clerk will close the roll. There being 119 ayes and 11 nays, the bill as amended is passed and its title agreed to. Next bill on the calendar for the day is Senate File 844. The clerk will report the bill.
Senate File 844, number 8 on the calendar for the day, substituted for House File 771, the first engrossment, a bill for an act relating to the environment.
Call upon the member from Roseau, Representative Fabian, to introduce his bill.
Thank you, Mr. Speaker and members. There is an amendment that's being handed out.
There is an amendment at the desk. The clerk will report the amendment.
Fabian is moving to amend Senate File 844, the first engrossment, as follows. This amendment is coded A1.
Call upon the author of the amendment, Representative Fabian, to introduce his amendment.
Thank you, Mr. Speaker. Simply what we're doing here in Senate File 844 is amending on page 1, line 8. We're changing the 5 to a 7. So that's what the amendment does, Mr. Speaker.
Discussion to the A1 amendment. Discussion? Seeing none, all those in favor of adopting the A1 amendment, please signify by saying aye. All opposed, nay. Motions prevail. The amendment is adopted. Discussion to the bill. Representative Fabian.
Thank you, Mr. Speaker. This is an issue that's been a pressing issue in much of rural Minnesota. Class 1 demolition landfills that take different construction materials if you're building a house, the extra materials that you need to get disposed of. They might be involved in a renovation. Some of these demolition landfills are really quite small. The one in Roseau, for example, only takes in about 7,500 cubic yards in a year. And what the problem has been is that the demolition landfill people feel like the MPCA is not abiding by the rulemaking procedure, and they're using guidance documents to create new requirements for permitting. And this has been going on for many, many years. And so what I'm doing is trying to foster a conversation between MPCA and our demolition landfills throughout much of rural Minnesota to get this issue resolved.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File 844 as amended.
Third reading. Discussion to the bill. The representative from Dakota, Representative Hansen.
Thank you, Mr. Speaker. Would Representative Fabian yield for a question?
He will yield. Representative Hansen.
Thank you, Mr. Speaker. And Representative Fabian, it appears so we have a Senate file that you just made a slight change to. So in terms of process, then there would have to be a conference committee if it went back to the Senate and things could be added to it potentially. Is that correct?
Representative Fabian.
Thank you, Mr. Speaker and Representative Hansen. Well, I suppose a lot of things are possible.
Further discussion to the House File 844, Senate File 844. Seeing none, the clerk will take the roll on the bill. I don't know. Clerk will call the roll. There being 130 ayes and 0 nays, the bill as amended is passed and its title agreed to. Next bill on the calendar for the day is Senate File 1616. Clerk will report the bill.
Senate File 1616, number 9 on the calendar for the day. Substituted for House File 1619, the first engrossment, a bill for an act relating to human services.
Call upon the author of the bill, Representative Schomacker, to introduce his bill.
Thank you, Mr. Speaker. And members, this bill is a fix for some of the things that CMS has done over the last couple of years. When it comes to hospital funding and reimbursements at the federal level, there is a disproportionate share hospital rate that is applied across the country, and there have been some changes, first in interpretation and then into the rules from CMS on how they were going to calculate that rate. And so what ended up happening as a consequence is that our children's hospitals in the state had trouble then getting the funds that they were expecting to get. For the children's hospitals, it comes out to about $25 million of a loss this year if we don't make this fix. And so all we're doing in this bill is to take the Medicaid dollars that would have been going through that match in the DISH funds and putting that into an alternate Medicaid fund, Medicaid formula, so that they can still get the money and be able to serve our most sick and needy children in the state. I ask for your support.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File 1616.
Third reading. Discussion to the bill. Seeing none, the clerk will take the roll on the bill.
The clerk will close the roll. There being 130 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 712. The clerk will report the bill.
House File 712, number 2 on the calendar for the day, the first engrossment, a bill for an act relating to health.
The gentleman from Scott, Representative Albright.
Thank you, Mr. Speaker. Members, House File 712 is a bill that defines biological products. We have spent the last 40 years working with both name brand drugs as well as generics in probably the last 15 or 20 years. What the innovations that have gone on in the pharmacological process over the last several years invite us to participate in what are biosimilars now. It's a very exciting opportunity that I think has great opportunities, but that being said, we need to bring along the code as well as the pharmacy and their ability to provide those therapies to the patients that are prescribed those by their doctors. With that, I would encourage a green vote. Thank you, Mr. Speaker.
Seeing no amendments to the desk, the clerk will give the bill its third reading.
Third reading, House File 712.
Third reading, discussion to the bill. The clerk will take the roll. The clerk will close the roll. There being 130 ayes and 0 nays, the bill is passed and its title agreed to. Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there is no objection, we will take action on these motions first. Hearing no objection, the motions prevail.
Hoppe moves that Senate File 444, now in the General Register, be re-referred to the Committee on Ways and Means.
The gentleman from Carver, Chairman Hoppe.
Thank you, Mr. Speaker. That is my motion. I have just been speaking to the chair of the Ways and Means Committee, and there's a provision in the bill that we're changing Representative Kahn's language from a few years ago in terms of how alcohol is served at the Capitol. And by way of doing that, we're creating a new account to put money into capital preservation. And because we're creating a new account, thus it has a fiscal impact, and it probably should go to Ways and Means. So we'll send it to Ways and Means and then bring it back after we get that resolved. Thank you, Mr. Speaker and members.
Discussion. All in favor say aye. Opposed say nay. Motion prevails. Reports from the Committee on Rules and Legislative Administration.
Report from the Committee on Rules and Legislative Administration. Pepin from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Monday, May 8, 2017, and establishes a pre-filing requirement for amendments offered to the following bills. House Files 678, 740, 1418, and 1443, and Senate Files 879 and 1549.
Announcements. For what purpose does the gentleman rise?
Thank you, Mr. Speaker. I have an announcement to make. Members, you should have received an invitation from the International Institute of Minnesota to attend the Festival of Nations this weekend at the St. Paul River Center. The International Institute of Minnesota Festival of Nations is the oldest and longest multicultural festival in the Midwest. The goal of the festival is to inspire people to discover more about our world and embrace the rich cultural diversity brought to us by our global immigrants. This year's festival will be May 4th through 7th at the River Center. More than 100 ethnic groups will come together for a unique experience that celebrates cultural heritage. It includes art, exhibits, dance, music, and food. And President Lyndon Johnson once said, "Art is a nation's most precious heritage." By providing a stage for the new art and artists that are being woven into Minnesota's fabric, we work to share, document, and secure this most precious heritage. Please join me in attending the Festival of Nations this weekend. Thank you.
Thank you, Representative Lee. Announcements. The lead from Hennepin, Majority Leader Pepin.
Thank you, Mr. Speaker. I move that when the House adjourns today, it adjourns until 10 a.m. Monday, May 8th, 2017.
Representative Pepin moves that when the House adjourns today, it adjourns until 10 a.m. Monday, May 8th, 2017. All those in favor say aye. Aye. Opposed say no. The motion prevails. Leader Pepin.
I move that the House do now adjourn.
Representative Pepin moves that the House do now adjourn. All those in favor say aye. Opposed say nay. The motion prevails and the House stands adjourned until 10 a.m. Monday, May 8th, 2017.